Hello, this is Alicia Sam and you're watching HW News. The COVID-19 pandemic is still raging over the world, with India seeing a hike of 41% daily COVID cases today. It doesn't stop there, as there is an outbreak of monkeypox in the Western country. Although none of the monkeypox cases is reported in India, it sure keeps us in worry, with the Health Ministry releasing its guidelines for the same. Now, surprisingly, another extremely infectious virus has resurfaced in India, the Norovirus. Let's discuss this in today's video. The Kerala government confirmed 2 cases of norovirus infection in 2 lower primary school students in Thiruvananthapuram on June 5. State Health Minister Veena George warned that the virus is highly contagious and emphasized the need to be vigilant. Norovirus infection has been detected in 2 children and their health condition is stable. There is no need to be concerned at the moment, but everyone should remain careful and maintain cleanliness, George told news agency PTI. As per officials, the students got food poisoning after consuming midday meals served at the school. The virus that is similar to the diarrhea-inducing rotavirus spreads through contaminated water and food. Last year, Kerala had reported norovirus cases in the Wayanad district. As per a report in Times of India, the outbreak affected 76 people at the College of Veterinary and Animal Science in Pukod. The water sources of the college were chlorinated after the college suspected the students of catching the virus from a local fast food center. Now let's talk about what is the norovirus. Norovirus is an extremely contagious virus that causes vomiting and diarrhea. It can infect people of all ages. It is also called the winter vomiting bug or stomach flu or stomach bug. However, it is not related to other viruses that cause the flu. The virus has a short incubation period of just 24 to 48 hours, but it can also take 1 to 2 days to take effect after exposure. The patients experience stomach pain, vomiting and diarrhea post-infection. Most patients recover completely without any medical treatment within 1 to 3 days. However, some need urgent medical care as the resulting dehydration is a greater risk. The elderly, infants and people with pre-existing medical conditions are at risk of dehydration. Now let's talk about the spread of this virus. The virus spreads through contaminated water and the tiny particles of the feces and vomit of infected individuals. The microscopic viral particles can contaminate food, water and surfaces. The norovirus is extremely contagious because only a tiny number of particles are needed to infect an individual. The disease is animal-borne and it spreads to humans through water or food that has been contaminated by the infected animal's feces. This can be through contact or other vectors like houseflies and cockroaches. According to the US Centers for Disease Control and Prevention, an infected individual may shed billions of viral particles over the course of their illness. Even though the illness only lasts a few days, individuals can still spread viral particles for weeks afterwards. The virus usually spreads in close confines like hospitals, nursing homes, childcare centers and schools. Places where it is easier for infected individuals to cross-contaminate water and food are at higher risk. Much like other viral diseases, some individuals may be asymptomatic after being infected by the virus. However, they can still infect others. Now let's talk about the symptoms of the norovirus. Diarrhea, vomiting, nausea and stomach pain are the common symptoms of the disease, while fever, body ache and headaches are also seen sometimes. Now the treatment for the virus. There is no specific medicine to treat a norovirus infection. However, patients should increase their fluid intake in the form of soup, juice, oral rehydration solution, electrolytes and water to stave off dehydration. Most patients are able to recover within 72 hours from the onset of their symptoms, but patients must be careful to not spread the disease to other individuals since they can still shed viral particles even after they have recovered. Now the prevention of the virus. Proper hygiene is essential to prevent an infection. Washing your hands with soap before eating or handling food. Cleaning and disinfecting surfaces and maintaining proper hygiene when sick can stop the spread of the disease. Ensuring that the infected individuals stay apart from individuals who are at risk of falling severely sick is also advised.